They told me it was just a routine procedure, but halfway through, I stopped breathing. They never told me. I had to find out from the secret report, months later. I almost died during a 7-minute endoscopy and no one told me. I'm a veteran. Earlier this year, I underwent what was supposed to be a routine outpatient endoscopy at a health surgery center in California, referred through the VA's community care program. For a procedure that lasted only 7 minutes, they administered 400 milligrams of propofol, a powerful anesthetic with well-documented risks, especially for patients like me with obstructive sleep apnea. During the procedure, I stopped breathing. While in recovery, I overheard nurses saying someone had turned blueberry purple and had just started breathing again as the code team arrived. I didn't realize at the time they were talking about me. I mentioned I had a headache, and that's when the doctor came back in and casually told me I had stopped breathing for about a minute, that they had to push on my jaw pretty hard, but that I should be fine. I was discharged shortly after with no mention of the incident in my discharge paperwork. The official procedure report said, no complications. It wasn't until I later obtained the internal records that I found out what actually happened. My oxygen dropped to 22%. I was unresponsive, not breathing spontaneously. A code blue was called. I was given ambu bag valve mask, ventilation. A jaw thrust was used to open my airway. The hypoxic episode lasted 3 to 4 minutes. The version of the report sent to the VA minimized everything. Patient desaturated to 23%. With effort, recovered well without issues. That caused delays in neurological follow-up, and my symptoms were downplayed. When I pressed for answers, I received this response from the grievance committee. Despite the respiratory arrest, code blue, and emergency intervention, they claimed. The grievance committee has reviewed your medical records as well as the prior investigation notes. Upon review of the medical record, and as previously discussed with the surgery center leadership, it is noted this was a procedural complication due to a change in vitals. As evident in your chart, there was no further action necessary after your symptoms were addressed. Your condition did not warrant further review or rise to the level of a sentinel event as defined by the Joint Commission. This information was also reviewed with you following your procedure. After that, they escalated me to outside legal counsel, who told me, file whatever you feel you need to. Since then, I've experienced word-finding issues, cognitive problems, balance difficulty, phantom foot sensation, tinnitus, persistent headaches. And sometimes, I smell cigarette smoke out of nowhere even though I don't smoke and no one around me does. Some of the symptoms, I've learned to live with. But the ones that bother me the most are the phantom smells and the concentration issues. They've made work, daily tasks, and even holding a conversation noticeably harder than before. I've filed formal complaints with the Medical Board of California, the Joint Commission, VA Office of Inspector General. I'm sharing this now because I shouldn't have had to fight this hard just to understand what happened to my own body, and I know I'm not the only one. If you've experienced anything similar with any facilities, post your story below. Make this thread impossible to ignore. The only way these systems change is if we stop letting them control the narrative. Make this go viral. Make them answer. No one should receive 400 milligrams of propofol for a 7-minute procedure, stop breathing, require emergency ventilation, and be sent home with paperwork that says, no complications. Veterans deserve better. Patients deserve the truth. No one should almost die in a routine procedure and be told nothing. If this happened to me, it can happen to anyone. Share this. Make them answer.